A talk about the environment includes everything and everybody in it, living and non-living. Train up a child the way he should go, and when he grows, he will not depart from it. Today, we are talking about children and the role they can play to help us get the country clean. My name is Seriam Abla D'Souza, and you're welcome to Clean Communities, funded by Star Ghana. Reported cholera cases within the Greater Accra region are at 7,800 cases, up from 6,179 within a week. On Clean Communities, we are still working towards the common goal of city authorities to get rid of this menace. Our focus community this week, Kaklamadu, our lenses really followed the children.
Hello, once again, we are welcome back to La Kakramadu. I am Joseph Niukai Mensah.
And I'm Joseph Niado Mensah.
And today we are looking at children. We found out that this community has only one public toilet. And so we want to look at children, whether they also been going to the seashore to defecate when they have their nature's call. What do you have to say about that?
Actually, it's a big challenge to the entire community of La Kakramadu. So it's very important that we look at that areas as to how the open defecation and the cholera issues arises.
Wanaka biana no oba nshone na ni oba wa ofo nshona ba wa mini ha oba nshona wa
the toilet.
In the toilet, you are good name. Toilet, you say, no. Even though many or ya toilet me ni oba inshona. We spoke to this little boy whom we just saw defecating openly at the seashore. And so we tried to find out why he chose to come here and defecate. Even as people are looking at him, people are around, he doesn't even feel shy. He just came and do his own thing. And then he told me, oh, because he doesn't have money to pay at the public toilet. But where do you live?
I live at La Police Station.
In your house, do you have a toilet there?
No.
So where do you go when you have a nature's call?
I go to the public toilet.
Why wouldn't you come here and then defecate on the seashore?
No. They said there is cholera around, so we shouldn't defecate on the seashore.
Do you have a toilet in your house?
No.
If you want to go to toilet, where do you go?
I go to the public toilet.
Do you know people who come to the toilet, who come to the seashore to use themselves?
Yes.
So what do you have for them? What have you been telling them since you don't come here?
I told them say that they should not come to the seaside.
Do you have a toilet in your house?
No, please.
So you don't have a toilet. When you want to answer nature's call, where do you go?
We just go to the public toilet and pay and go inside.
You go to the public toilet. Why don't you want to go to the seashore?
Because if you defecate around, it may bring flies around, so people may get cholera.
Your final words to your brothers and sisters who has been going to the seashore to defecate.
You have to tell them to stop defecating around so that people to get healthy and so that do not fall sick every day because there is no money.
Since food prepared under unhygienic condition is one of the ways to contract cholera, we decided to visit Kaklamadu during their Homowo celebration.
We are most grateful to the Almighty God for granting us such a beautiful day, a beautiful month in the history of La. When August, we organize our Homowo. Homowo in simplicity is hooting at hunger. Well, we were told our forefathers during those times there was famine, and immediately they came out of that dilemma or that struggle for food, then there became abundance of food. So every year in the history of La, we celebrate this very occasion. Cleanliness is next to godliness, and we see ourselves as godly people. We love each other, we care. Therefore, we should engage ourselves in that cleanliness.
Show some love. Don't worry, we'll show love. Do it right now. Right now.
5 communities are participating in the Clean Communities project. Kaklamadu in the Greater Accra region, Nadina in the Volta region, Gumani in the Northern region, Kojo Krom in the Western region. Now, today we have updates from Gumani and Kojo Krom.
Some residents of Kojo Krom, in collaboration with the assembly member of the area, Mary Mensah, have organized a cleanup exercise to rid the community of filth. The exercise was part of measures the assembly member has initiated to encourage residents to regularly embark on such activities. The logistics for the exercise were provided by members of the Church of Jesus Christ of Latter-day Saints, who also joined them to clean up the area.
Why did you choose Kojo Kurom?
Yes, just as we understand it, the members over here consist of ACM and painting in Katia Kurom and the Kojo Kurom. So based on the fact that we did a number of consideration, and we found out that if we are to come and work at the Kojo Kurom market here, it's going to help the market women, because we found out that when it is raining, normally it's flooded because of the gutters which are very choked and other things. Then we have to think about the market women and how we can help them be okay in this market area.
Why did you decide to participate in this exercise?
So for us as missionaries, we always like to share the gospel. Our message is about Jesus Christ, and the way we share that is through service, because sometimes people, they'll see us teaching, but when they see us working, they are more ready to listen to us.
What do you seem to achieve?
We want to instill cleanliness in the community so that people will be able to realize that when they are clean, the environment is clean, they themselves will be free from other diseases and other things.
Yes, I say, Isha, Ibn Kondo no Obafa, no Abo community. No.
As a Sami memento, a fair communal Wamba. Nagata Sina, a choking so ben Maywaji, but on the Medobia, Yelba Waba. What can obey the major or there, me who can be numbers of was on there were two new community, war bob warm what the Moquasso, Conodo, a CC, Juma Wally, and when ye more different. Babom community, I was a bois, Gana Manso.
Women play a very significant role when it comes to sanitation, particularly when it comes to waste disposal. They are most of the times at the center of the whole process, and they face a whole lot of challenges as far as the process is concerned. We would be exploring some of these challenges and also attempt to find out what they are doing as women in their own small way to solve the sanitation problems that they are facing. With me this morning is Abdul Samad Aisha. She's a resident of Gumani. She'll be speaking to us, and she will tell us some of the challenges that she is facing as a woman as far as waste disposal is concerned and the general sanitation situation in Gumani is concerned. What are some of the challenges that you face as far as the poor sanitation situation is concerned?
Some of us, they don't give us Zoom Lion to come and take our rubbish, so they always pour rubbish at the forest. Children, there are no more toilets, so children always go there to shit. Even sometimes we always complain about the assemblyman, how they poor sanitation, but they always say that they will get situation to us, but they don't.
We want you to give us a picture of how the bad sanitation situation or poor sanitation situation in Gumani is affecting you as a woman.
Thank you very much. The sanitation situation in Gumani is very bad because there are no refuse places for us to dispose our refuse. And even in our homes, we don't have toilet facilities, so people defecate around the environment, and we throw rubbish anyhow. And as we throw rubbish anyhow, it brings about some bad effects in our homes, like we get cholera and other contagious diseases, airborne diseases.
Yeah, we want to know how the bad sanitation situation is in Gumani is affecting you?
As for talking about bad sanitation, if I'm going to count, I will not end it now. Because one, we don't have a specific place where we dump our rubbish. Unlike this Zoom Lion containers, if like there is a place where one is placed so you can go and pour your rubbish, we don't have such. We used to pour rubbish around our house. There is a big gutter. But as you know, anytime it rains, if a gutter is choked, the water doesn't get free flow. And this one can lead to flood, as it normally happens in Gumani. So we are compelled to dump our rubbish at the back of our house, which is very bad. Because you see, when the air blows, all this rubbish that we dump there, it comes back to our compound. And we have children around. They can pick anything into their mouth, which is very bad. This thing can lead to either diarrhea, cholera. And aside that, we have kids, they go to school, we go to work. In the morning, you are making plans and arrangements to go to work early, where you have a challenge to see to it that your child would pass physics, and then you go and throw it far away. You can imagine the time, even we the adults, when you want to go and free yourself. I mean, the public toilet we have is just, I can see only one around, which is a very far distance. So imagine in the morning you are making things to go to work and you have to travel a distance to come back. It's very bad. As for Gumani, I can say it's terrible. It's very terrible. It's very terrible.
Small way are you doing to help solve the problem?
Once a while during the weekend, as you finish your working, just at the backyard where we pour the rubbish, I normally come out, or with colleagues in the house, we gather the rubbish and burn it. Even burning this rubbish, it's not even a good practice because we pollute the air. And we, those who burn it, we are the same people who take in this air we are polluting. And aside that, just this individual work cannot help. It can't just salvage the situation.
We are here at the Wash House and I want to talk to Habib Yakubu. He's the project coordinator for the Center for Global Safe Water, SaniPath, at the Emory University. You're welcome to Clean Communities.
Thank you.
Now today I want to talk about children and their access to safe water, access to these wash facilities, toilets and all that. And we know you've done a couple of researches into that. We'll talk about that later. But let's start first of all with the situation on the ground. What is the situation regarding children's access to toilet facilities, to hand washing stations and all that?
It's very poor. The WHO has a standard for how many people use a latrine. And if you go to most of our schools, especially the public schools, there's a large number of people using a very small number of latrines. So it's very poor. What we've seen now is that most of the schools do not conform to the recommended number of latrines per student.
And how many people per latrine according to the World Health Organization?
For a latrine, it should be at least, for one latrine, 5 people.
So as in one hole for 5 people?
Yes.
Okay, so they have to build their toilet facilities based on the number of pupils in the school?
Yes.
But in a situation where the numbers increase and decrease, how do they get that calculation, or should there be a standardized one in every school?
So it depends on the enrollment in the school.
Okay.
So it means that if the school is expanding, then they will have to build more latrines. But in the current situation that we have more students than recommended number of latrines in the school. And if you look at these schools, the latrines have been there for several years. There has been no improvement in them, and they are in very poor shape.
I guess that is detrimental to the health of the students, right?
Yes, it is. Actually, our study showed that when we went to these schools and took some of the swabs. So we took when we took swabs, means the latrine walls that they use, the soil around the latrines, they were highly contaminated. So it means apart from them being in poor shape, it's a health hazard now because they are not being kept well.
And so how many schools and how many regions did you do this research?
Our study is, we worked in Accra in 4 communities, Alajo, Bukom, Agbegloshi, and Shabu, which is near Mamprobi.
These areas are what people may term as the slums. So it means that the problem basically is in the slums, not in the other schools.
If our study focused on low-income urban communities, where we think that's where there's a major problem on about sanitation.
Was there a particular reason why you chose to do the study in these schools?
Yes, because if you look at it, it's projected that in low-income urban communities, there's going to be rapid growth there. All the people coming from these rural settings, when they come to the cities, that's where they can easily find accommodation. Okay. So they all go and settle down there. This has led to crowding in those communities. So there's a communal exposure which leads to disease transmission.
We know there are public schools and there are private schools. Which of these two performed better according to your research?
The private schools, the public schools, the situation there is not good.
I'm sure they gave you reasons. The heads of these public schools gave you reasons why they are not conforming to the standard.
Yes, they all say there are no funds to take care of this.
But do they know about such a policy from the World Health Organization that one hole should be used by 5 people?
Yes, most of them know, but they tell us there's no funds to build these new latrines for the schools.
Right, let's talk about hand washing in schools. Do you say that the schools have done well in that regard?
It's this, what we saw, we did what we call structured observation. So we had people there stand for a whole day, watch the students use the latrine and come out. And only 1% of the children, out of 268 students that we observed, wash their hands with soap after.
Now that's amazing. Is it because they didn't have the provisions for that? The children themselves did not know that when you come out of the loo, you need to wash your hand?
Yes, we think that the problem is most of the schools we went to did not have hand washing stations, and 2, the children were not educated about that.
So it boils down to education and then the availability.
Yes.
But what were the reasons given for not having these hand washing stations in the various schools?
It's the same reason as before. You know, people attribute this to lack of funds, and there is no funds for this, there is no fund for that.
How much will it cost? Because I know that it's just about getting soap, a bowl, and water.
Yes.
Is that not all that you need?
That's the predicaments that we are in. It's amazing because you just need soap and a bowl of water for students when they come out to wash. But most of these places we went, there wasn't anything like that.
It looks as if this won't cost that much. And so if they are attributing the lack of these facilities in their schools to lack of funds, won't you say that the teachers or the headmasters of these schools don't have the children at heart?
So I think I'll leave that to your audience to judge, because when you go there and they don't have these things, it's a problem. And we find it shocking that they all say that lack of funds. A bowl that you can put water in and soap now, I don't think it's that expensive for the school to be able to provide that to students.
There's also another school of thought that believes that it is not good for a large number of people to use one bowl of water to wash their hands. So then they are advising that they use running water from taps to do that.
Yes, so when I say hand washing station, that means there has to be, for example, a Veronica bucket which has a tap on it. A tap on it that you can wash. So it's going to be running water, and you have the soap beside that. So the students just open it and wash their hands. Yes.
When you talked to the students, what were their reasons for not washing their hands? They say they were not educated on that.
1, they are not educated. 2, there's no water, there's no soap.
So who should be blamed for all these?
1, I think I'll blame the school authorities, and 2, lack of monitoring from the Ghana Education Service.
Don't parents also have roles to play?
Yes, maybe that's one also. So the parents that go to the schools should also put pressure on if they have a PTA or the headmaster for the children, so that children can wash their hands after they use the latrine. You know, washing hands is not, it has to be critical. So as soon as you come out from the latrine, it's critical that you wash your hands. If you move and go somewhere else, you might before get there use your hands to do something else and expose your whatever you have to other things. So it's critical that right after you use the latrine, you wash your hands.
Are we not jumping the gun to an extent? Because I know of homes which have no toilet facilities in there, so the children will have to dig the ground and then defecate. So in such situations, you realize that they also will not wash their hands at home. Are we not heaping too much blame on the school authorities?
So this, what we observed was in the schools. Even in the homes that we also went in the homes. You know, we had caregivers and their children, and they weren't washing their hands even after they cleaned their children defecated. The caregivers were not washing their hands. So it's a general problem. People are not well educated about washing their hands, either after eating, before eating, and also using the latrine.
So how do we get out of this canker? How do we solve this problem?
I think the major problem is education.
Okay.
Education. I know the
education on whose part?
One, education. You have to educate the parents and educate the children on washing their hands after using the toilet, before eating, and after eating.
And then what should also be done to the schools that do not conform to the set standard?
You know, this is a behavior. So you need behavior change communication strategy. Fortunately, we have very good strategies. The Environmental Health and Sanitation Department has a good strategy on how to go about this. But people are not picking up on it, and there's not the push to educate people, especially in what we have, this kind of situation. We have cholera outbreak everywhere. I mean, it's very essential that people wash their hands.
All right, so let's come down to your research in Accra. We've spoken a bit about that, but what did you generally find wrong in the educational sector, especially with children and the accessibility to hand washing facilities?
In nursery schools, what we saw was that only 11% in nursery schools. So we looked at primary schools and nursery schools. Only 11% had a hand washing with soap. I think it's important to emphasize with soap. Hand washing with water is not enough. You have to wash it with soap. When the children used the latrine and they came out, we rinsed their hands. Those who didn't wash their hands, we rinsed their hands to see what's in there. And I can tell you that about 86% tested positive for E. coli, which is an indicator of human fecal contamination. Okay. For primary schools, 21% of the schools that we assessed only 21% had a hand washing with soap. And what you see at these schools, I'm talking about these schools also, is that most of the children drink pipe water. So it means that the school is providing water from a source which is piped. Most of them don't drink the sachet water. When we tested them, they were contaminated.
Okay.
So it's a problem. You know, you have to clean that thing almost daily, especially for schools where they use it very, very often. So it has to be cleaned. So most of the water that we tested in the schools, in those ones that were stored, were highly contaminated. And what also was interesting was that the soil around the schools were also contaminated. We still trying to find why it's that way, because we haven't observed what's going on. But the soil around the schools is contaminated. Most of the time when the children come from break, that's where they play. Okay, and if the soil around that place is contaminated, then it's a problem. So it's something that I think future research will be looking at.
You realize that most of these people are not doing the right things. We've only spoken about the nursery schools and then the primary schools, and we spoke about their access to hand washing facilities, hand washing with soap, emphasis on that. What about their access to toilet facilities? So especially in the low-income communities, some of the schools even don't have latrines. The children, they defecate they put a very big bucket there, and then they put a structure, like a wooden structure behind it. Children go and defecate inside, or the children have to leave the school and go to the nearest public latrine. And you can think about it, these latrines, most of them are not accessible for children. So it ends up that the children openly defecate all over their neighborhoods, because then they don't have access, because when they come to school, especially in these communities, when you want to use the toilets, you have to pay. And these kids, the children, even the parents don't even go use there. So how much more the children? So I think it's important that all these schools that are springing up, very small schools, you see them like 50 or 60, but the children, it's turning into a health hazard, because the children are not being properly, being properly taken care of in the schools. How can the GES help in this regard?
GES, I know for sure, is they have a school hygiene policy. The policy is very nice, but I think the issue is that they don't have money to train people and monitor what's going on in the schools. UNICEF is helping them with this, but I think they are underfunded and they need support.
Does this affect their children in any way, health-wise?
Yes, like I mentioned before, about 96% of the children that we rinsed their hands and tested in the laboratory tested positive for E. coli, which means that there is a high probability that the children will get sick if they use their hands right after to eat food. It's not good for their health because they'll get sick. They'll get sick, and this is one of what we are seeing now is that these things are in the environment. When it's dry, they are in the environment, they are everywhere. But when it rains, then they are exposed, then they are spread everywhere because it goes into homes, and the bacteria can move very easily, especially in the wet and rainy season.
So the bacteria moves faster in rainy season?
Yes, yes, they thrive because then there is water for it they thrive in water. So when it's rain and they are everywhere, especially when they are in the soil, because when you defecate in the soil, sometimes when it's there and it's hot and dry, I mean the bacteria die because they don't like the heat. At high temperatures, the bacteria die. But when there is water, then they survive. They are able to survive in water.
Well, then I guess this will have an economic effect on the school and then on the parents of these children as well.
Yes, the economic effect, I think there has been, I think, some study on it, but not with children. But generally, lack of poor sanitation in Ghana is probably, the estimate is about $260 million a year. That's a lot. I think it's undervalued. Because think about it, when children are sick, one, it means they don't go to school. They lose school hours. Two, the parents have to take them to the hospital. So it means the parents lose productive hours at work. Three, they go to the hospital, they pay for service. It means that the parent, instead of saving money to do something else, have to pay to treat the child. Four, the government has to subsidize in paying for the services that the parent brings the child to the hospital for. Okay? Which means that hospitals are going to be, you have to pay more people, more hours, and provide medicine, which are all subsidized. If we reduce all these costs, it's going to really improve the economy.
Now, what are some of the dangers these children will face because of the lack of toilet facilities in their homes and in their schools?
So, one, if there is they don't have a toilet in the school. It means that when it's time for them to use the toilet, they can. It's not close by, so they have to go further away. When they go further away, they are not within the confines of the school. It means that then they are exposed to other dangers in the community. Some students go looking to use the latrines, and then they end up with these hoodlums in their community and stuff like that, because the teachers don't follow them to where they have to defecate.
Apart from this, are there other dangers associated, like being knocked down by a car because you have to cross the road? Exactly. Or being bitten by snakes in the bush? Exactly. All these issues that you've raised are very relevant in terms of when the children don't have access to a latrine. So how do we stop the spread of these communicable diseases that usually arise in the rainy season? Starting from the children. Yes. The issue of when it rains, then people will be there's trash everywhere, taking trash and thinking that after the trash is cleared, the drains are cleared, then cholera is gone. People are not having places to ease themselves in these communities, whether it's raining or not. And they are finding ways to do that elsewhere, which is coming back to our homes when it floods or when it rains. So I think the policy of each household having their own latrine, so that we are able to contain where these feces go. 2, where the feces go is very important. There's a need especially in Accra, to have where the feces is dumped. When the feces go into the sea and it dumped, like in our study, we show that the ocean around that area is highly contaminated. People go and fish there. Children go and play there. And they go back into their homes and they meet their friends. So that's how it spreads everywhere. So there has to be a holistic plan, right from containing the feces in the homes, in our public places, schools, providing adequate sanitation facilities in schools, and also generally, where is all this feces going? It has to be treated so that it's safely disposed of. That's a $1 million question. Where do the feces go? But now there's one school of thought that also believes that the children should be the starting point if you really want to change things as far as sanitation is concerned, because when you get them young and you start teaching them at that particular age, they'll grow up with it. What's your position on that? Yes, I support that position. You can educate people about how to wash their hands and all that. It's important, but when you don't provide the facilities for them to use it, then your education goes wayward. They'll be using coping behaviors to find ways of getting exposed to feces. But so you need adequate facilities, and then you can talk about hygiene. When you don't have adequate facilities, then hygiene issues, although me and you are sitting here, we don't want to be exposed to feces, but when somebody comes in and doesn't wash their hands and shakes us, you get it, although you wash your hand. Okay. Looking at how we dispose of waste in our homes, you realize that it's the children who do that most of the time. Now, in this case, the child goes to the refuse dump and it's full. The mother tells the child, just throw it anywhere. And the parents not teaching the children the bad thing. That's why I said we need education, not only the children, the parents also have to be educated that when you throw trash, it comes back to you. You'll be throwing it in your neighborhood, but when it rains and it spreads, it's going to end up where you are and you get exposed. Even if it's not in your neighborhood, all those people living in East Legon and all those places, they work with people who come from these low-income communities. They meet with them, they are laborers, they are secretaries, and they can easily get exposed. So it's important that parents are also educated on how to safely dispose of their waste. Now, what message should we be giving to the kids in terms of littering about? What message should the parents and should the general public be giving to their children? My take is that, one, you can advise children to have like a dustbin where you can put your trash. But if this dustbin is not being collected and disposed of, and it's full, and you can't dispose it of, where do you want them to dump it? Do you understand? So it has to be holistic. One, from the household will do its work. When they are provided with dustbins, they can easily dispose it off. When in our cities, we have places where when you are walking, you have a sachet water, you can easily find somewhere to dispose it. And when the city itself provides services on time,
where waste can be collected.
So children have a say in the design of toilet facilities and the provision of these, because there are some children who say that really I go to school and the hole is so big, I fear I'll fall inside, so then I would rather dig a smaller hole somewhere and defecate. Should the children have a say in what type of toilet facilities they should use?
I think there is standards for latrines. It's well documented, which children can safely use. So it's not a new thing. Worldwide, it's a standard where latrines are built where children can easily use. So it's not. It means that when you go somewhere and the children can't use it, it hasn't been built well. If it's been built well and designed well and it's followed through the letter on the standards that are available, the children should be able to use it. These standards, I'm sure, have been developed with the children in mind.
Though the children don't have a say in that, there's a standard that needs to be followed.
Yes.
But per your research, has the standard been followed, especially in Ghana?
Some of them have meet the standards, but most of them, I would say, have not met the standards.
It's not because they don't really know what the standard is. For example, okay, let's make it simpler. We know the normal WC in our homes. Is that the standard for the children?
So the normal WCs in our homes are made so that children can also use it.
Okay.
So it's the same thing when you're building latrines. They are made so that children can also use it. Okay. So if you follow what is available, if you go to the Environmental Health and Sanitation Department, they have designs there, and if you want to follow it, it's just that we are not. The regulation is not working.
It's the implementation of the laws that usually become the problem.
Yes.
Won't that cost us in any way?
Yes, because if the hole is too big and the child can't go, the child will find somewhere else to go and defecate. And that place will be a drain, a place that's open. And when it rains, it comes back to us, and there's cholera everywhere.
Well, now how about the children with disabilities? Have we really thought about them?
Yes, these days in the new designs that are being developed, or that the GES and the ministry recommends, is to have at least one hole that is accessible for the disabled. To my knowledge, the new places that are being built, they have that incorporated.
How about the old schools?
Those unfortunately don't have it.
So what should we do to those schools, or what should those schools do?
I mean, it's all about trying to also, if you have children, disabled children in your schools, I don't think it takes much to put a ramp or to add an additional one where these children can have access to the toilet.
Usually people do blame government for some of these things, but are there governmental policies that determine what should be done to the children with regards to their access to wash facilities?
Yes. The policy, we have good policies, but it's not being implemented. So if you go to our policies, we have it right there where the school has to provide adequate sanitation facilities. But when you go down, it's not actually being implemented because there's no regulation. There's regulation, but there's no monitoring.
Okay, so it means that the policies are not being implemented because there's nobody to monitor them.
Yes.
And whose duty is it to do that particular monitoring?
We have the Environmental Health and Sanitation Department. Every municipality also has an environmental officer. For the schools, they have school health teachers. So they are supposed to monitor these things. But to my knowledge, I don't think there are enough people who are doing this work.
So what should be the way forward in all of this, especially with the children in mind?
For us to develop in this country, cholera is like, if people hear it, is 19th century disease, but we are saying we are middle income country, and there's cholera. It's a shame. There has to be a holistic approach in tackling sanitation in this country. And I mean holistic, I mean right from where we defecate to our public spaces, and also where all these feces go. It has to be contained and treated so that it doesn't come back to us as diseases as we are experiencing now.
Have we lost the fight against these diseases?
I'll say yes, because almost every year it happens. Almost every year there's a cholera outbreak. So it means that we are losing the fight, and there has to be a new leadership response in terms of tackling sanitation.
And is it too late for us to go back to our old ways?
No, it's never too late. It's never too late. We know all that's wrong with sanitation in this country, and we just have to enforce the laws in this country to make it work.
How do we start off with the children in mind?
The children need education, but when you educate them and there are no adequate facilities, then that's a problem. So it has to be, when I say it has to be holistic, you educate the children, you provide the facilities so that they can use it.
So we need to educate the children and then get the facilities as well. Yes. Now let's touch a little more on your findings. I'm sure there are other things that we haven't touched on, but they are in your findings, especially when your findings dealt with children.
I think I've mentioned some of the major ones. Was that the soils in the schools are highly contaminated. When we swapped, when you swap the desk, we took samples from the surfaces from desks in nurseries. They were also highly contaminated. When you look at the toys that they were playing with in the schools, they were highly contaminated. Okay.
Should we introduce the children to the use of hand sanitizers and all that?
I would say no, because it has been proven that hand washing with soap is the best. You can have hand sanitizers. It's a good thing. But with children, this is alcohol, okay? With children, providing them with this, they don't know how they'll play around with it or even put it back in their mouth. When you wash your hands with soap and water, it's safe. But with sanitizer, it's alcohol in your hands.
The other day, I was talking to somebody who said that even the grown-ups, we usually get it wrong. We move out of the loo, we wash our hands with soap, and then we get back to cleaning our hands with the napkins, which are already dirty. Are we getting it wrong?
Yes, I think using napkins at a public place, so everybody uses one napkin, whether it's a restaurant or it's a chop bar, it's wrong. Okay. These days we have paper towels where you can use it, and after you wash your hands, you clean it, you just dispose it off. So that's a better way of cleaning, of washing your hands.
The person's emphasis was that we don't need to wipe our hands with the napkins. All we have to do is that after washing our hands, we should just leave the hands as wet as they are so the air dries them for us.
I mean, if you can stay, normally when you get up from the latrine, you want to go somewhere, your hands are wet. So you want your hands to be dry. The best thing is to keep your hands dry, is to clean it or air dry it. If you're able to air dry it, it's fine. But I'll advise that you don't touch the napkins, because when 2 or 3 people touch the same napkin, you are bringing bacteria into the napkin. That is if your hands are not clean.
Okay. And how about the use of sanitizers right after washing our hands?
If you go to more places, and it's recommended more places, hand washing with soap is recommended. Sanitizers have come in to fill in the gap where there is no soap. You understand? But I think it's recommended that you use soap to wash your hands after using the latrine.
There are other people who believe that we have not done well in propagating the message according to hand washing with soap. Why is that the case?
There has been a major campaign in this country for a long time. It was a major campaign of hand washing with soap, and it worked, but for some reason it has lagged, which means that we are not doing our work well. There's no constant, there's not that constant education going on. One, the school curriculum. Right now in the school curriculum, it's just being developed, but we don't have a curriculum that talks about washing your hands with soap. It's people go there and they advise. So it's now that it's being developed, you have like school health clubs and stuff like that that talks about washing your hands with soap every time you use the latrine.
Should we have a special course? For example, when I was in basic school, that's what we call life skills. So should we have a special course for something like hand washing campaign?
Yes, I think every school should have a curriculum, whether it's a course, a health club or something that advises children about these. This is very essential.
And what should be the primary focus of these clubs?
Primary focus is trying to everybody get healthy, to stay healthy, to stay healthy.
And so we should have something like a hand washing club in the schools.
Yes, hand washing club. You know, in the school. That's a good idea.
Okay, all right. I think we'll end it here.